So let's talk about pasting, or buttering is another term that doctor might use when it comes to putting glue on brackets. So we have a new setup of our brackets, right? Some pits brackets. So you take that off and you open it. When you look at the braces themselves, can you see those little dots of color? They're actually color coded so that we, as the assistant and doctor, knows where they go. So it's pretty important to kind of memorize what color stands for what bracket. Some brackets are universal, meaning they can go on the same-ish tooth, maybe in the same quadrant. Like when you look at these upper bicuspid brackets, they're purple. So that means they're universal, meaning this 5 bracket could actually go on the 4. You could swap them, they're the same prescription. If you look here on this lower anterior, lower 2 to 2, those are universal as well. So technically this lower right 2 could go on the left 1, you could mix them, there's no right or wrong. Otherwise, they are all specific, and same thing with the molar tubes. In each quadrant, like 6s and 7s are universal, you could swap them out, they're the same thing. But they just have to stay in the right quadrant, making sure that they are color-coded appropriately where they go. When it comes to pasting these brackets and bonding them actually on the teeth, there's a specific order that doctor likes to go in, and I'll show you that. So we're actually going to turn this around, kind of like we're actually in the patient's mouth. This will help you get that order correct a little bit easier. So we're actually going to start on this lower left 7, and we're going to paste all these brackets all the way across to the lower right 3. Then we will come up here and do the upper left 7 to the upper right 3. Then once that's done, then we go from the right 7 to the right 4 on the lower, and then we do the top, upper right 7 to upper right 4. So it's just a matter of starting in a specific order, stopping where we're supposed to, and then picking back up on the other side. So there's a difference between anterior and posterior brackets. Anything upper lower 3 to 3 is considered an anterior bracket, and anything 4s through 7s is considered a posterior bracket. So we have 2 different types of holders. This is an anterior bracket holder, and this is the posterior one. This just kind of slides like this. You push this up, and this one you just squeeze it and it opens. So when you look at your setup here, we're going to start on this lower left 7. So it's going to be easier if you'd actually take it out of the holder, and you're basically just going to clamp this, open that up, clamp it right on that bracket. I'll show you an anterior one. I take out this lower left 3. If you look at this holder, there's a slant, or like an angle to that holder. We want to make sure that when we take this bracket out, that it's oriented in the correct position, how it goes on the tooth. And then we take that angle, and that angle is always flush against the tooth. So when it holds the bracket, this is the correct way. Let me show you how it looks when it's incorrect. So you always want that angle pointing down on the top and the bottom for like upper and lower. So we're going to turn that around just like that. The upper 7s are a little bit different. I want to show you. I'm going to take one out and show you. So if this is an upper left 7, instead of coming straight on this way to that bracket, we're actually going to lay the holder flat and grab it this way. So this is an upper 7 setup, and I'll show you the lower one. The lower one goes straight on. It just makes this upper one a little bit thinner so that when he goes to put it in on that upper left side or the upper right side, it's a little bit more flush, like with the cheek and all that. So it's just set up just a little bit different. So instead of using this new setup, I just pulled a couple brackets. I want to show you how to put the composite, or the glue, the paste, whatever you want to call it. There's a few names, right? So since we're going to start in order, we're actually going to pretend we did all of these, right? And then we're going to come to this anterior bracket. So I'm going to grab it with that slant side down, I guess you could say, however you want to look at it. So I'm going to move this out of the way so it doesn't try to focus on that. When you look at the back of this bracket, it kind of has like little indents in it, and it kind of has a little like well to it, I guess you could say. It's kind of like dipped. It's not very flat. So what we're going to do is we're going to take our composite, get that first little bit off in case it's kind of cured from being in the ambient light. So it's just a matter of putting a little bit in that well. Okay, we don't want to like use our fingers or our hands to like tap that little dot of glue in there, because your fingers have oils and stuff on them. Even if they're clean, we want to make sure that we don't, quote, contaminate that composite and like prevent it from sticking to that tooth. So you can use the inside of this and kind of smush it, almost like you're trying to like put butter on a slice of bread, where you kind of like smush it in those grooves, right? So it's just a matter of trying to get it pasted or buttered, and you want to make it kind of, you don't want to be too little of glue, but sometimes too much excess can take time away from doctor, like putting it on the tooth and then having to clean up around, so that can waste a little bit of time. So you want just enough on that bracket. Then we're going to come up here, grab this upper 7, remember on the side, not straight on. The molar pads aren't as dipped as those anterior, or actually the rest of the brackets. They're a little bit flatter. So same idea, right? Just a matter of putting composite on there. And again, see how it's kind of like just bubbled on there? We want to like smush it into the bracket pad itself, so it gets in there. All right, let's watch again, shall we? So here's a upper left 5, which remember is universal. It can go on the upper left 4 if it has to. Kind of a well, right? Clean up any extra composite. There we go. Smush it in there. And then sometimes you're like, oh, well, that holder didn't hold very well. So again, grab it. Look at our paste. It's not bad. We just gotta smush it around a little bit. Here we go. So yeah, it's just a matter of actually like smushing it into that bracket pad, so it kind of gets in all those nooks and crannies. And then adding just a little bit so it kind of fills that well of the bracket.